What I hope we walk away with is that we realize all voices do matter, that we realize every interaction matters, and that we don't ever forget that you matter. See, there's a recognition in healthcare today that the voices of those that we care for and serve, the healthcare consumer, is going to influence what's happening. The reality is the trend is telling us that this is important work, and it's because the people that receive care from us across segments in healthcare are demanding it. We are on the right journey, and I think we have a lot of opportunity ahead. Little lady, elderly lady, and she said, "Jason, I thank you so much for letting me share my voice." She said, "You know, I was on my floor, and my partner was late." She said, "But I turned around, and there was this nurse standing there, and she was just like the biggest smile." She said it was almost scary, because she's like, "Hey, how can we help?" And she told me, I said, "We?" And almost miraculously, from behind this one nurse, popped out two more nurses, you know? That if I'm a patient in a bed, or if I'm a patient coming into a practice or an outpatient facility or in any setting, do I sit there and distinguish between, ooh, this is a safety moment, this is a quality moment, and this is a service moment? Do I? Do you? Do your family members? No. But we still distinguish all these different things in healthcare. And I think fundamentally, when we get back to it, it comes back to the definition what we started with. It's about the interactions that we have. It's about the culture through which we provide care that the greatest things happen. But it's now, how does that link to the kind of outcomes that we want for patients, that we want for our families?
And I think what we find is that the integration of ideas, the ability to share voices in partnership, is key. But fundamental to that, something that I write about day to day, is that patients and families are partners in their care.
So it makes the sharing of ideas much more easy to do. It makes the collaboration and sort of dissemination of practices much more effective. And ultimately, hopefully through that, we're all collectively improving the healthcare systems around the world. So we have to start from that point. And I hope when we talk about what really matters in patient experience, we realize with the end in mind, we are all the patient experience. If we ultimately understand that every interaction matters, and we get the fact that you matter, you being you doing the work, you meeting the people back at home doing the work, and you meeting those folks that are receiving, then we will understand without a doubt that we are all the patient experience. So let me ask you again, how many people here are the patient experience?